RSV, COVID, and the flu are wreaking havoc for a lot of families this season, and it's important to know what we can do to stay safe and, of course, healthy. Joining us with more is Dr. Emily Volk, president of the College of American Pathologists. Dr. Volk, welcome back to ISF.
Thank you so much.
We've seen the headlines, RSV, and mainly its effect on children and young adults, but also grown adults can experience and be infected with RSV. Many don't know what it is or how it's spread. Enlighten us.
Well, RSV is a common respiratory virus that likes to attack the small airways, mostly in children, but sometimes in the elderly. And it is a virus that we don't have a specific therapy or vaccine for. And because it likes to attack the small airways, it can start off as pretty mild, cold-like illness, but then it can quickly go bad and really cause trouble with breathing, a lot of coughing and congestion. And in young kids, they can stop eating, which is very worrisome for parents.
Why are we seeing a surge in cases now, doctor?
Well, we're having what we're calling the immunity debt payback. So what do I mean by that? Over the last couple of years, we have done a great job of social distancing to keep COVID-19 at bay. In doing so, we also had fewer infections of other common respiratory viruses like RSV. So fewer infections means there was less immunity built up. So now that we have a population with less immunity, we're having more severe infections.
Sounds like we've been robbing Paul to pay Peter when it comes to our health, doctor. So you mentioned these symptoms, coughing, sneezing, things that are akin to the flu and also COVID. How can we tell the difference between those three infections?
Well, as a pathologist, I can tell you the best way to tell the difference between these three infections is through testing. And this is testing that really needs to be done in a clinical laboratory, an emergency department, or an urgent care center.
Of course, the holidays are here, Dr. Volk, and families want to travel and be with their families. So taking precautions is ultimately the best way to protect yourself. How can we do that?
Truly the best precaution you can take this holiday season is to be fully vaccinated for both COVID-19 and seasonal flu. We know that for COVID-19, about 68% of Americans did get that first shot. However, only about 50% of those folks got the booster, and only 13% of those who got that first booster got the most recent booster that really does a nice job of protecting you from the variant that's circulating right now. The other thing is seasonal flu. About 40% of Americans have gotten that vaccine. So there's an opportunity for many more to get the vaccine. It's very effective against this strain of flu this year.
Where can we go for more information?
You can go to cdc.gov or to cap.org.